The information in this podcast is for entertainment purposes only. Consult your healthcare provider for proper care regarding your specific situation.
Welcome back, guys. Okay, so today we're going to talk about testing during pregnancy, and not just necessarily, it's why it's important for the baby, not just you, but for the baby as well. Because I mean, I know it gets tedious, but anyway. But first, if you were here for our last episode, we started doing baby food taste tests, and we have another round of it, which I'm weirdly excited about for whatever reason. So
we did have fun with it.
It was fun. So yes, so Delena's daughter went and picked out several jars of baby food and portioned them out. So we have them numbered. So we don't know what they are. So we're going to guess. I'm terrible at this game, but it's still fun regardless. And yeah, so we'll see what they are. So
yep.
And then
Ed's got the jars.
Ed's got the jars, and so he tells us what they are. So
He tells
I'm
us
excited.
how badly we guessed.
I'm terrible. Out of, what was it? So we had 5 of them last time, and I got 1.5 correct.
I got 2. We'll see how this goes
Okay.
today.
Delana gave herself half a point, and then half a point, and then a full point. So.
It's
Okay.
like I got 1 ingredient right, 1 ingredient
Yep.
wrong. But anyway, okay. So, starting with this one. I'm just trying to figure out, this
The
looks
color.
like yellow curry. They make curry baby food.
We have another, we have a thicker Frank's Red Hot sauce one now.
Oh, yeah. I wonder, that one must be sweet potato.
I'm not even like.
Oh. Okay. I thought maybe
Nope.
squash at first, but I don't, it doesn't smell like squash. What in the world?
It's another smoothie type thing.
Is it orange?
I was thinking mango. I don't know though. Your thing has a little frowny face in it. Do you see that?
What thing? Oh,
No, right
I'm
here.
talking about the, oh my gosh. Oh gosh, if y'all could see that. It's a warning. It itself is warning me.
It's not
Go
mango.
take a picture.
It's. I know you should. This is behind the scenes. Look at this sad little face right
It's like,
here.
you don't want to eat this.
Another behind the scenes. We are offering this exclusive. Delena's trying to keep her mouth shut, but this exclusive signed by Delena Rattled Nurses lipstick lip liner piece, a memento
Yes.
for Valentine's Day.
Yeah, we were getting a little too
Rambunctious.
rowdy. Getting ready.
Yep.
And I was talking too much. So I put tape on my mouth. And there we go. It's a kiss.
And then it came there now.
A kiss.
I still don't really know
For
what this is.
Valentine's Day. We just had. I think you might be right on the mango.
Mango and something else. Might be something dumb like mango and sweet potato.
But look, it must be.
Now it's angry. That one's angry.
What is happening? This is funny.
This is
I'll
why
take
we
a
don't
picture
work
of
together
this too.
anymore.
They separated us.
They
on the
did.
shifts. That's so funny. Okay.
This looks like the sorting
Put that
hat.
on there. I don't know. I mean, I think you might be right, but
There's something
I
else
don't
in
know,
it, or
I
maybe
don't
not.
know.
Can I make a guess?
I said mango and stuff.
Okay.
Mango stuffed smoothie.
Well, you'll at least get a half a point.
I
for
probably
stuff.
Oh, that is all encompassing.
Yeah, okay. Mango. It has a sweetness.
It's mango.
That's it?
It is mango.
Just mango?
Yeah.
Do I subtract half a point for the stuff?
No. The other stuff was more mango.
That's why I liked it. It just needs some tamarind on it. The tahini.
Yes. I like me some tamarind. What?
This one, the next one.
This is
Oh, the
thick.
next one.
Thick caca.
I have,
Strawberry?
that's what I'm thinking.
No.
Strawberry something is what it looks like. Or guava.
Ooh.
Kind of looks like guava. Oh, that tastes very familiar. That's strawberry banana.
I was thinking strawberry banana too.
Yeah.
Is that your final answer?
Yeah.
Banana blueberry.
Oh.
Blueberry.
I feel like they don't put strawberries in
Okay.
baby food anymore.
Maybe not, because I feel like there's more strawberry allergies.
Yeah. Yeah.
That's actually, that's really good, y'all.
It really is good. Autumn did right. Look at her go. I told you she was going to be nice to us.
This is one of those that you want to be like the babies and bounce it down, flap your arms over. Do that.
Does it have any sugar added in it?
None of these do.
Wild. What's wild?
Banana blueberry.
All
Okay.
natural.
All natural bananas?
This
Yeah.
one's Gerber. Both of them are Gerber.
Okay.
That one's really good.
Palate cleanser.
Oh yes, we shall. I can still taste the.
This one's going to be carrot, sweet potato, pumpkin. I don't know.
What did you say?
I was naming all the orange things. I don't know my orange vegetable differences.
Something that grows in the ground.
Holy crap.
That's a gnaw.
Go ahead.
Gnaw.
You go ahead. You go and guess it.
Oh. Oh, okay. That is definitely yams. Is it yams?
Well, sweet potato, yeah.
Sweet
Yeah.
potato.
Okay. Yeah, I knew it for sure when I tasted it.
So guys, last episode, we had one that was carrot, and it looked very similar, and we both thought it was sweet potatoes, but it tasted like sweet.
Yeah,
It tasted like sweet potatoes. This is sweet potatoes with no sweet.
that's for sure. For sure, sweet potato.
Okay, this one's going to be tough.
Just give me some cinnamon pecans and butter and
That
marshmallows.
Texas Roadhouse stuff with all the mix that in
Yeah.
there. Okay, this is number 9. Love
Girl, I was about to go there.
wavelength.
Is it a love potion though?
Oh, no.
Ew. Ew.
I don't want you guys to be jealous, but this is watery.
That's squash, isn't it?
I think it's squash too.
I do like squash, but
Butternut. I'm going to say butternut squash. Squatternut Bosch.
yeah, it's squash. Squash?
Butternut squash.
Okay.
Look at me going this round.
So far, these are all Gerbers, by the way. But 2 of them are organic.
Excuse me, sir. You're not invited. Thank you.
What? Oh.
That's how we know
Okay.
spring is happening.
Okay, girl. Give me your spoon. You're getting the airplane treatment.
No. We're going to spill it on each other, or somehow I'm going to mess up my microphone, and this one is a little messy. Where's my bug friend? I'm about to feed him.
Okay.
Blueberry.
This definitely is something sweet. Smells good too.
Dude.
Oh no, that's not just blueberry.
Blueberry pear nana.
Banana berry?
Per-
Banana berry.
Uhangi.
That's a weird combination
See if he wants some.
thing. Oh my God, go away. What is that?
It's just stink bug.
Mm.
Yeah.
Here.
Don't.
No, just
What? I was gonna push him off. I wasn't gonna squish him.
Boop. Oh, he's like, no, I'm here for the show. Welcome to our viewership. This is a love bug.
it was Charles.
Charles.
Charles. I was trying to think of a name for him, so that's a good one.
Okay, I can't place this. I feel like
There's a banana blueberry.
it's multiple
It is.
fruits.
Blueberry pear nana.
I mean, the color tells me there has to be blueberry in there.
It's not bad. It's pretty good.
But I can't figure out anything else. I don't
What's
know.
your verdict?
I feel like it's got some lemon in there, whatever it is.
I think they all have like citric acid in there.
Yeah, probably.
I'm eating this whole thing. I'm a classy lady, okay? I'm saying blueberry pear. No, blueberry banana. I don't know.
I'm not picking up any banana, but I don't know. There may be. I don't know.
Just tell us the answer.
Okay, tell us. All I know is blueberry.
Banana, mixed berry, and apple.
That was in everything.
Apple. Okay. Okay.
That was the pear I was thinking.
Okay. I can pick up on the apple now that you say
Mixed
it.
berry.
Yeah.
I just got blueberry. I didn't get the mixed. That was fun. Autumn, we need gross ones next time. I feel like that would be hilarious.
She got nothing green, did she?
No, she didn't. She was nice. She was nice to us.
Hey, I
I thought there would be
like
like
green vegetables.
I thought there would be like a sweet turkey gravy dinner. Sweet,
Oh, yeah, yeah.
like mashed potatoes and peas or something like that.
Well, you beat me on that round. I was just 2 points. I don't know what you got, but it was more than me.
I don't either. I wasn't paying attention. I was more impressed at my butternut squash.
Yeah.
Apparently, I know more vegetables.
Man, this dude keeps coming back.
He'll go away. That's Charles. Just let him be here for the. Get him and put him on the boob. That's all he wants.
Yeah, apparently. Never mind. Okay.
All right. So, okay, now let's get down to business. I'm all hyped up on my non-sugar dinner. You guys, I didn't eat today, so that was my food for today. Okay. So, we're chatting about things that we're going to test for during pregnancy. And this is inclusive but not limited to. Okay, so just depending on your situation, your health status, your other things, you may have to have more things done than this. But we're going to tell you not just what it is and what they're doing, but also how it affects baby. And that's, I think, the most important, like on our ends, because when we receive report as nurses, and we know some of these things, it guides us into what we're doing for baby, not just mom's care, but baby's care as well.
Right.
Okay, so yes, we go through a lot of testing. Well, not we, but moms go through a lot of testing during pregnancy. And yes, it gets a little tedious, but it's happening for a reason. So, and like I said, if you are a higher risk pregnancy or what have you, you may get referred to an MFM, which is a maternal fetal medicine physician that follows you more closely for very specific things.
Yep.
So, first things first, you take your little pregnancy test, you find out you're pregnant, you go to the doctor, and when you find your OB, please find an OB. Don't just wing it. This is why we're telling you this, because we want it. It's not just to scan baby and make sure your labs are okay and do your vital signs. We're also monitoring baby for very specific reasons. But they'll do your first appointment, they'll do an intake, background, your overall assessment, your L&P, which is your last menstrual period. So they'll do like an estimated due date type of thing. And then they'll do baseline vital signs. Sorry.
Charles keeps coming back from water.
They'll do baseline vital signs, and also that's to measure, and every time you go to a visit, they'll want to do vital signs just to make sure you're not having like hypertensive episodes. Moms can have maternal hypertension. That's okay. That happens. And if they need to treat you for it, give you some sort of medication for it, that's totally fine too. So that's why that happens. But your first ultrasounds are not going to necessarily, of course, be for like sexing the baby, that type of stuff. But they look for certain things like nuchal cord translucency to see if there's any like neural tube defects, because that's like, of course, what's developing first.
Placement of the placenta.
The placental structures, which they'll do that again like multiple times. But like baby's nasal bones, like if there's some fetal abnormalities, certain chromosomal abnormalities where you can't always see the bones like initially. And so that kind of helps determine if the baby's going to have defects to prep you for that. And that will be for closer monitoring and referrals if they find something. Blood testing as well. For, your enzymes, they're probably going to look at your hormones, like your pregnancy hormones, things like that. And again, chromosomal testing.
Yep, checking urine.
Blood, urine, blood counts. If you're anemic, they'll add like folate and, a little bit of extra iron to your regimen because that baby's going to sap all your good old nutrients. So things like that.
Yeah, and things like folic acid, and if you have a deficiency, cause neural tube defects, and just different anomalies. So they do everything they can to prevent that. So we're checking early on. Oh my goodness.
I'm so sorry. Can y'all see him right now? He's babysitting, okay?
Oh, Lord.
He is babysitting Polly. Welcome to spring in Texas. Things come back alive. Okay. Also for, moms, like clotting disorders. They can have clotting disorders that may lead to like early pregnancy losses and stuff like that. So that type of stuff too.
Yep. And even the blood pressures. If your blood pressure gets too high, that can cause abruptions and.
Oh yeah. So that's the first trimester. First trimester. Then we go to the second trimester. So this one again.
A lot happens in the second trimester.
And a lot happens in the second semester. Semester?
Trimester.
I always have school on my brain, even though I don't go to school. Oh, it's so ingrained. But again, routine labs, they'll again check your vital signs. They're going to do that every single time. And here it's usually 18, 20 weeks. I feel like it goes past that too. I don't know for sure. Yeah. But they'll do an anatomy scan, checking for fetal progression, make sure baby's growing, the measurements are good, things like that. Checking your placental structures, your amount of amniotic fluid, make sure baby's in a nice, cushy, healthy environment. Also, make sure your baby's kidneys are working. Good things like that. And also, again, checking for any abnormalities. If we're going to find them, we'll find them. Like, they'll try to find them.
Right.
A lot of the times, this is where some things can go miss. So don't get me wrong here. I mean, we try our best as healthcare professionals, but some things can get missed and then not seen again until further on. So
there are times we get surprises.
Yes.
When baby's born, but there's so much technology nowadays, even compared to when I first started doing this, that I feel like there's so much more that is caught
Yes.
than used to.
So a couple of the scary things on this one, and now these particular procedures are not necessarily done unless mom is like showing some sort of risk factors or what have you, or baby displaying something, or there's some sort of history for mom. So your higher risk, your older moms, your advanced maternal age moms. Amniocentesis. So this is one of the big ones. Now, this is an ultrasound guided procedure. We'll take a big fancy needle and they'll basically just go pull, ultrasound guided, they'll numb it, of course, and then they'll pull a little bit of amniotic fluid. And now this amniotic fluid has lots of cells and a lot of things to help us identify the chromosomal structure of baby. Yes. So, another one that they do, it's less determinative though, I think. The CVS, like the pharmacy, the CVS chorionic villus sampling. So they go in and take a little piece of the chorionic villi, which is part of the placenta lining. And they'll test that. I feel like it's got less information than the amniocentesis. So most people opt for the amniocentesis. We're just gonna,
That's
go
straight out of a horror movie.
It really is. He's just gonna live on the floor for a minute. It was blocking all my stuff, but now it's just looking a little creepy. Okay, so yes, checking the length of the cervix, everything like that.
Yeah.
Those are your big ones,
And
though.
then, yeah.
Anything
And then here in the second trimester as well, 28 weeks usually, to be exact, is when you'll get that dose of Rogam. I know
Yeah. Okay.
Yeah. So along with your blood test, they get your blood type. If you're Rh negative or if you're O positive, you're going to get a dose of Rogam during your pregnancy. And then depending on baby's blood type after delivery, you might get a second round.
Mm-hmm. Yep.
And we did a whole episode where we talked about
The Rogam. Yep.
Rogam blood incompatibility, and that was a good one if you need to look back at that.
Yep. Third trimester. More scans.
Oh my gosh, and so many doctors.
I was going to say, I've never been through this, but it's like, I think at this point, don't they do like weekly visits?
Yeah, it gradually increases. I think when you hit, if I remember correctly, when you hit third trimester, then you're going.
The third semester.
Yes. Then you're going to the doctor like every 2 weeks. And then when you get into that last, like to 35 weeks, I think, then you're going every week until you deliver.
Okay. Yeah, that's what I thought, but I wasn't 100% sure on that one. But yes, it gets very tedious. But again, they're monitoring at least your vital signs, because a lot of the times moms may start developing some sort of preeclampsia in this situation. You know, if that happens, they'll do urine tests. You may have to be admitted to the hospital to monitor. And this is not necessarily because they want to keep you at the hospital for your blood pressure, which is true, but these can lead to very severe circumstances. for example, God forbid, it can cause seizures if not
Yes.
controlled. Seizures, and mom can seize, and when that happens, baby does not get oxygen. So then we're putting baby at risk at that point. So it's things like that.
And what we're calling high blood pressure in pregnancy is not the same as a high blood pressure for someone who's not pregnant. So like 140 over 90, they're going to be watching you real close. And that isn't normally like too troubling of a number for someone who's not pregnant. But yeah, they maybe, some moms get started on medication at that point, or at least monitored more closely, for sure.
Because it can have, if it's not controlled, it can have severe impact on the baby. Like we talked about, abruption. Hypertensive issues can also affect baby's blood flow, of course. It's stressing the baby out at that point. Preeclamptic, and then now we have postpartum preeclampsia, which is in a whole nother situation. But
or baby gets real stressed.
Yes.
And then that's when you start seeing meconium in the fluid, and that can turn very much into a big deal. Because I mean, there's meconium on different levels. There's like just a small normal amount. I mean, not normal, but a small amount of meconium, or it can be so thick that it's like pea soup when your water breaks.
And if baby inhales that,
Yes. I mean,
severe,
baby could end up on life
ventilator,
support,
yes.
And, it's not good.
It's not common, but it does happen.
Right.
It does happen. We still see it.
And better off to be cautious. I mean, these aren't hard things to do. So to avoid that heartbreak and worry later, suggest the testing for sure.
We also had one for going back to fetal scans. We had a mom who had no prenatal care, and so we didn't have any visual on her baby, and baby had macrosomia. So baby had a massive head, and if they hadn't done like an ultrasound immediately prior, this is very grotesque, but something really horrible could have happened during that delivery. Like horrible, the worst you can think of. So that's why they do these fetal scans, to see what measurements, what baby's measuring at. Do we need to consider a cesarean section? Like, is something else going on? One of our previous colleagues, baby had SCT. So there was basically a genetic kind of tumor growing on baby, and they had to monitor that mama like bi-weekly, like every or twice a week, to make sure baby's heart was flowing, and they had to do echocardiogram or echo ultrasounds on baby in utero to watch that baby's blood flow. So there's so many things that they look for that it's unfathomable sometimes. But again, so make sure we can get a safe, healthy baby. Another one, glucose tolerance testing. Yes, we all know that everybody hates that. I'm sorry.
Yeah.
We're sorry. It's disgusting. It really is. It's disgusting. It really is. But if you can, you've done harder things in your life. If you can drink the goop and then do the tests, this will help better plan your care. This test for gestational diabetes, to see how your body is tolerating the glucose, because guess what? If it's not tolerating the glucose, you can start having a larger for gestational age baby. So, and if it's not controlled, then again, that's a stressor put on baby. For all moms that have gestational or chronic diabetes, we will do basically serial blood glucose levels. We'll do blood sugar checks for baby for several hours post-delivery to make sure baby is maintaining their blood sugars and they're stabilizing. And instances such as this, like if their gestational diabetes or chronic diabetes is out of control, baby may not be able to stabilize themselves, and they may have to go to the NICU for like a continuous dextrose monitoring drip for more intensive care. So again, this is one of those things that's not just your blood sugars aren't good, it's impacting baby. And it's specifically done so that we can monitor baby as well. And then your healthcare providers can be aware too. Okay.
Yes.
So we can also keep an eye on like, okay, well, this is, mom's gestational diabetes was not necessarily controlled. We're going to watch baby a little bit closer. We're going to make sure things like that. So.
Yes. And so on the glucose testing, there's that initial test. And then if you don't pass that initial test, then they'll have you repeat it again through a longer period of time. I think the second one is 3 hours.
Yeah. I think
the first one is 1.
Yeah, it's a 1 hour test, and then I think my friend had to do like the 3 hour one. She's like, I had to do it again. I passed it, but I had to do it twice. I'm like, I'm sorry, it's gross.
Yeah.
So yes, that's another one that they do directly impacts the baby. So that's why it's done. And then GBS.
Yay.
Good old GBS. So I think, correct me if I'm wrong, GBS is one of those things that you may have it for one pregnancy and may not have it for the next one.
Right.
So it can, yes, it can switch. You may not have
Whether
it
colonizes
or not.
in the vagina or not. Yeah.
So
Now, you can have GBS, and if you end up having to have a C-section, then it's not going to affect baby because it's growing in the vagina. Baby's not going to pass through. But if you have a vaginal delivery, we really want you to have had 2 doses at least of antibiotics prior to the delivery, and with that second dose being had 2 hours prior to the delivery. So that's what we consider a fully treated patient for group beta strep.
So yes, GBS, like she just said, group beta strep, it's mostly 35, 37 weeks. So sometimes if we're going into preterm labor, we don't know if you have it unless they do a quick little swab, and it sometimes takes a couple days to get back. But it seems a bit silly to people because they do take a swab and get your whole genital, urinary, anal tract, because we need to make sure, because, well, when baby's coming down that canal, they're in direct contact with it. And it seems like, okay, that's not a big deal, baby can get a bath. But no, it can be a big deal. And this is, it's one of those things, it's like, why risk it? Why refuse the antibiotics and risk it? Because if baby does get an infection, it can be, again, detrimental. It can be detrimental. And that includes, like, we've had meningitis. Babies that receive, like, they get meningitis. So that is spinal inflammation, spinal column inflammation, guys. That's serious.
Yeah.
Pneumonia.
They can be born looking great. You're not going to have any idea. But then, usually within the first 24 hours, sometimes after that point even, all of a sudden we'll start seeing a change in baby.
Yes.
You know, baby's temperature is dropping and you have trouble getting it up. Baby's breathing way too fast.
Their color changes sometimes too.
Yes, it
like
does.
they start looking
Super
greenish,
pale and
like
kind of gray.
gray, like, and that's at that point. Sometimes baby is septic.
Yes, at that point.
And and
gotta
then
act fast.
Sometimes it feels like we're making stuff up. We're like, yeah, baby's been great for 2 days, but all of a sudden I think we got some sepsis, and that's when we'll do blood cultures at that point. But an easy way to prevent any of that horrible stuff from happening to your baby is a couple doses of antibiotics.
And you know, I have seen some of the moms that, I mean, of course, we're only dealing with moms in the hospital, but sometimes we will get moms who start out with a plan to deliver at a birthing center, and then things aren't going as expected, and they end up with us. I have seen it to where the midwives at some of the birthing centers will prescribe antibiotics during the pregnancy. Like they know early enough that it's positive. And
Great.
So, I don't know that that's, as effective maybe as the IV antibiotics that we'd be getting here in the hospital, but it's better than nothing.
It is better than nothing. I mean, and sometimes it may be fine. Like I've known people who delivered completely naturally, birthing center, GBS positive, no antibiotics, and everybody's okay, which is wonderful.
It's just a gamble.
It is. It's one of those things that I think it's bothersome to me. It's like you're entitled to refuse a GBS test. Yes, you are entitled to refuse antibiotics. Yes,
but if you do, we'd like to keep an eye on you.
Yes, but
we don't want you going home at 24 hours.
Yes, and also it's one of those things like why, if we're gonna risk it, why assume that your baby is special above every other baby and that you're going to be okay? Why risk that type of thing? Why gamble on your baby's well-being like that? One of those things to me. So if it's a simple solution that otherwise doesn't impact your other delivery, I don't know. Do some research. I know it sounds silly that something in the vaginal canal can cause such detrimental side effects, but it can. We've seen it happen.
And if you are going to do your research, don't just Google. Dr. Google is not a good doctor. Make sure that you're looking at websites that are reputable, that have a board of physicians and research that backs everything up.
Yeah.
That's one thing I will say.
Not just Google, but the AI will start pulling up all sorts of stuff from all sorts of things.
Yeah, it's just pulling anything anybody put out there. It's not.
Social media is not, again, this is just one of my things. Social media is not a good research source. Neither is Reddit. Thank you so much. But please don't pull your information based on what everyone is telling you.
And the mom groups.
Talk to a physician, talk to a nurse practitioner, talk to someone that you feel like would give you an actual answer, but a truthful answer. So, and do educated research. But again, this is not saying you don't need to refuse these tests. Bad on you. It is your right as a person, as a patient, as a mother, that you can refuse these things, which is fine. But this is just how it impacts baby and why we are so concerned about it. Because it seems a bit silly sometimes, but there's reasons we're concerned. And a lot of the times, healthcare providers may not elucidate all this information. They may not say, hey, this is what we look for. And then you may go into the office and be like, what am I doing that for? Why do we care about my glucose? I'm having a baby. Why do they care about strep? I'm having a baby. Things like that. So a lot of the times healthcare providers are just so quick to get you seen and get your stuff done that they don't explain.
Yeah. I feel like it's always good to know why things are happening the way they're happening. What we're doing.
And a lot of the times now when we're just trying to, there's so many, if you're asking a question, like just making an appointment, they'll say, oh, well, you need to talk to your provider about that. Like people aren't allowed to give you answers a lot of time over the phone. And I know that gets frustrating because, we've all been there. But if you can send them like a portal message or something. But a lot of the times asking for answers, saying things like that, a lot of healthcare providers don't do it over the phone anymore. So they'll have you actually make an appointment to come chat with your doctor. But anyway, anything to add on these?
I think we're good.
Okay, here's my little story. Here's my little story. So I will say this kind of came from when I recently had my EGD scope. And this poor girl that was my pre-op nurse was young, like in her mid-20s. And I will say she did all the necessary testing, she did chromosomal tests. And when she had her baby, like there was no evidence of any chromosomal abnormalities. And when she had baby, she showed me pictures. Baby didn't display like any of your normal features of Down syndrome. Not one. And I don't know what they saw. Maybe it was the creases. I'm not 100% sure. Maybe it was like a high palate or ears. I'm not sure. But like the facial structure was completely fine. And then she said I had a surprise diagnosis of Down syndrome. My baby, she was like, they did genetic testing in the hospital because the pediatrician found something and wanted to do genetic testing. And she's like, they didn't catch that on any of my tests. And then she goes, I didn't see an MFM or anything because she goes, I'm 26. Like, it was not a high-risk pregnancy.
Yeah.
And she's like, it was her first kid. And she's like, I would have.
I know what you're talking about.
She's like, I would have never, ever, ever guessed. And, but yeah, she was showing me pictures and she was like, I was in the hospital. She goes, and I broke down crying. And she was like, those postpartum nurses, she goes, they didn't judge me. She was like, I love them so much. Like, they didn't judge me for anything. And, that's kind of what we're here to do. Like, we're not here to judge you. We're here to help you, to educate, to things like that. So,
Absolutely.
Yeah. Shout out to that little nurse. She had the most gorgeous little baby. Loved her so much. I was so nervous, and she's sitting there showing me pictures, and I was like, this is so helpful. This is on the other side.
It.
On the other side, you're like, thank you for that. So, girl, when I get my press gainy, it's going to you. But anyway, so I think that's about all to add. Yes.
Yep.
I just want to tell my little story.
I can't think of anything.
Okay.
I can't think of anything now.
Yeah.
It'll happen later.
Right. Always does.
I'll tell y'all later.
All right, guys. Well, thanks for joining us. Like, follow, subscribe, leave some comments for your fellow mamas, and have a wonderful day. Bye.
Bye-bye.
Thank you for listening today. The Rattled Nurses podcast is not intended to provide medical advice. It is not endorsed by our employer, and we are not speaking on behalf of our employer. Our commentary and stories are our own.
Also, on a serious note, we want you to know that if you are feeling blue or depressed, it is okay. You're not alone, and there is always someone to reach out to. You can call the National Maternal Mental Health Hotline at 1-833-TLC-MAMA, or text the crisis line. Text HOME, HOME, to 741-741. Remember, you're doing a great job. Now go warm up your coffee.